So what would you say is the most important thing in like choosing a surgeon? What do you think people should look at? What are the things to consider? What's important?
Well, that's
I mean, we did talk about like make sure that that's a person that you're comfortable with, and so personality, and do you due diligence in your research. But what other like nuances do you think there are?
So beyond the personality, if you can, feel a trust and a bond, I think, there are just practical considerations that need to be, so where they're doing their surgery. Are they doing it outpatient? Or are they doing it in a hospital? So if there are significant, serious medical problems, it's really going to be best to do your surgery in a hospital where you can be monitored overnight or even longer if necessary. And
does a hospital surgery always have to include anesthesia, or is there anybody that would do a hospital like awake?
So this is coming into practical stuff. So almost always in hospitals, surgeries are done with general anesthesia. Why is that? Because there's a faster turnover time. You can get, you don't wait for the tumescent anesthesia, and the time in an OR in a hospital is very tightly regimented, and they just do not have the luxury they don't have the ability to have wait for the tumescent. And so now I do it in an outpatient setting, and I am blessed with two operating suites, and we have time, so I can go from one room to the other while after we tumescent them, and then we actually let them wait a little bit while the tumescent takes its effect. That's going to create a gel in this tissue. It's going to make it easier to remove, and so that's but these are practical considerations. So while most of these are done as outpatient procedures, there is quite a few. There are some who need it in a hospital. And then there's other practical considerations like the table weight, whether the
BMI consideration. That was one of the questions yesterday. They said, do you have a BMI limit? And actually Dr. Wright was the only one that said that he did have one, but here's the explanation why he has one.
Yeah, so I do have a BMI, and I wish I could do everybody, but again, I'm not the surgeon for everybody. I help as many as I can. I'd love to help everybody, but there are limits, and I have a BMI limit, and part of that comes from my lymphatic background, and so we know that the higher the BMI, the rate of secondary lymphedema. So lipedema and then secondary lymphedema goes up by a BMI of 50, which is where my cutoff is. 60 to 80% have lymphedema
by that point.
in addition, and that's gonna affect the healing. And then
does it affect the surgery as well?
Well, it not doesn't affect the surgery per se, but it does affect the amount of compression required and but
ease of healing.
Yeah, and then there's also the so by a BMI of 60, you're about 90% have secondary lymphedema. Yeah.
Right. And then also, don't you have like table limits or equipment limits as well?
Right, exactly. Yeah. And so yeah.
So these are not just like, oh, roll the dice, like, oh, today I'm going to decide this is what I'm going to do, or we're setting this limit. Like there's practical reasons.
And it is about patience. So I am happy to I want everybody to have the best experience and the safest experience. So there's plenty of patients I refer to trusted colleagues. who can do it in the hospital, in a hospital OR, and but there's so many conveniences to doing it in an outpatient. I mean, it's more private. There's the risk. I get always the same team. My team knows exactly how to work best with me and how to best manage my special lipedema patients. So they are really specialized, and that's very helpful. I mean, and to be fair, hospitals are a little inconvenient, and they have a lot of sick people in them. I mean, so it's not.
It adds to the risk.
It can add to the risk. I mean, I'm not saying. Sure. I think these are all things to.
I mean, just from a practical perspective, people that are coming into your center they're not coming in sick. When you go to a hospital, somebody there could be sick. Right. So
for sure.
So that's a reality, right?
Yeah, it's just a reality. Yeah, but again, it's the best place for people.
Somebody who who has the complications, because you need that team. You need all those ancillary people that are either they're in there with you or they're down the hall, that they're there in a second, right?
Exactly. Yep.
Okay.
Perfect.